she announce us? I don't know. Ask her. Say Jen. Jen, did you already announce us?
Hi, everyone. Can you guys hear me? Welcome to this session of the Tourette Association's virtual conference. I am Jen Kidaru, Communications Coordinator at the Tourette Association of America. Thank you for joining us today for what your care team needs to know. We would like to take this opportunity to thank our Conference Platinum sponsors, Amalex and David Amundsen, our Diamond sponsor, Oracle, as well as all our donors and supporters for making this free conference possible. To help us continue to provide educational programming like this, please consider making a donation. Your gift will assist the Tourette Association of America in continuing to provide critical support and resources to the Tourette syndrome and tic disorder community. Please visit tourette.org/donate to make a contribution today. During today's session, we would be very happy to hear from you and include your voice in the conversation. You may ask questions or share comments using the question panel on the right side of your GoToWebinar player at any time. We will collect your questions and address them during the Q&A session at the end of the presentation. It is now my pleasure to introduce our presenters, Sandy Price and Meghan Turner.
Meghan and I would like to welcome you all and are so glad that you joined us for our talk. I am Sandy Price and I'm the Nursing Program Coordinator for the Center of Excellence in Kansas City, Missouri at Children's Mercy. We are going to present today on what your care team needs to know. The goals that we've established are how to use your smartphone to share information, pertinent information to share with your care team, and what the patient and family's expected outcome is for the visit. Disclaimer, neither Meghan nor myself have any conflict of interest. Children's Mercy Center of Excellence is a site of research for the TMS, but we are not part of that. Okay, let's get started. And let me introduce who exactly that we are. We are a Center of Excellence at Children's Mercy in Kansas City. We have a fairly good-sized care team. We have pediatric neurologists and nurse practitioners out of the neurology department. We also have child adolescent psychiatrists, a neuropsychologist, a family therapist, an occupational therapist, and then we have neurology and psychiatry registered nurses. Right now we serve 14 states. Last year we had approximately 5,000 clinic visits. We see kiddos to young adults, so from ages 2 to 22. And we see everything from tic disorders to Tourette plus with all the comorbidities, sensory issues, anxiety, OCD, ADHD. One of the places to get started and really help your provider know the most information about you is to start with your history. We look at history of movements. When did they start? What were they? Many times individuals will present after having issues with eye blinking or sniffling that people thought might have had something to do with allergies. So try to keep on track of when those might have started. And a lot of times it's easiest when you look back over time, because tics are something that can occur for quite some time and not really be noticed by anybody. The other piece that's really important is to start to look at history of comorbidities. Kiddos typically can present with ADHD, obsessive compulsive disorder, anxiety, sensory issues. Look at all of those, and you won't necessarily have a diagnosis for them, but you'll have some idea that your kiddo's doing something that just doesn't seem real typical. Maintain a history of any previous testing and specialty visits to rule out other conditions. Like I stated, many individuals start either at the ophthalmologist because their kiddo's blinking a lot or blinking hard or moving their eyes around, and they think that there's something wrong. They go to the ophthalmologist and they find that they may have a little bit of allergy or a little bit of irritation, but there really isn't a problem with their eyes. And then the next step typically is to an allergist because of sniffing and throat clearing and still those eye movements that might be due to any type of allergy presentation. And last but not least, your family history. And this is not one that many families really like to talk about, but when you talk to me and I do an intake, I'm going to ask about all of these things. I'm going to ask if there's any history for obsessive compulsive disorder, anxiety, ADHD, sensory issues, tics, or full-blown Tourette. I want to know if you as parent had any of these, if your parents did, your siblings did, if there's anyone that you can think of that may have. And please bear in mind, you may not have an actual diagnosis, but you can tell if you see somebody that's a little OC or a little anxious, you know those things. Or if you see somebody with tics, even though they may not have a diagnosis, these are all important things to share with your provider and keep within your history. Next, we move into medications, and not everybody's going to have a medication history, but boy, you think you're not going to need to keep this, but medications change pretty rapidly sometimes, and we don't always remember things over time. So you want to keep a list of all the medications that have been trialed, and then you're going to look at the response to those medications because your provider is going to want to know how well it was tolerated, how well symptoms were covered, if there were any side effects, or if there were any allergic responses, because all of those are real important when you look at medicines. The other piece of this, when I asked you previously if there's any family history of any of the disorders, I'm also going to ask if any family members have been on medication. It's important to know if there are family members that have been, say, on an SSRI, like maybe Paxil, no, not Paxil, forgive me, I didn't mean to say that, for Prozac or Zoloft. If you have a good response to those, there's a good chance that your child will also have a good response. So we look at those things and start asking questions about those. 1-ohm testing or pharmacogenetics is not real new to us, but it's a really important piece of testing, and not everybody has access to this. But what it does, pharmacogenetics, there is a swab that is used to kind of brush the inside of your child's cheeks on both sides, or even yours, because you may, as a parent, have had this done also. It runs a test then that allows us to know how well that you metabolize certain medication classes. And I'm not going to go into all the specifics on like which piece metabolizes what, but what I will tell you is from this testing, we can observe to see if you're a rapid responder, and rapid responders kind of chew through their medication and don't seem to get much of a response to it. And then there's those people that are really slow metabolizers to medicine. And your provider may start to increase meds and you start to see a lot of side effects, and that may be because your body is just not using the medication very appropriately.
And I am Meghan Turner. I am one of the registered nurses, actually from the neurology division that works within our Tourette Center. And I have worked alongside Sandy pretty much since the start of this clinic. So her and I are a pretty close team, and I'm going to go through the rest of the slides with you guys. So the next piece is the importance of keeping records, especially with medications, because like Sandy said, it's really important that we know all of the things that you have tried and all of the responses that you have had to those things, so that when we make a plan for you going forward, we know where to start with medications. There's several ways that you can go about keeping record of that, but one thing that I think everybody always has on hand is their smartphone. There are apps out there that definitely help you keep track of taking your medication and things like that. But a few that I would say are important, if you can have these on your phone, would be the patient portal at your healthcare facility, if they have that option to you. Download that app to your phone, because that not only keeps your medication record, but it also helps keep some of your health record. So if you go to another institution and we ask about your medication, that would be an easy way to access that. Another one that I know a lot of parents and patients use within our clinic is their pharmacies app, the app that they can go back and see all of the medications that they've had filled. While it's not going to keep track of side effects in your response, it's going to trigger your memory to be like, oh yeah, we were prescribed that, we tried it, and this is how we responded. Another thing is, on an iPhone, you have a notes section. Just keep record of all of that. It doesn't even always have to be if it's about tic or Tourette, just medications that you've tried in the past and your response to those things. The next thing that we want you to be sure to share with us if you come to clinic, or to share with your care team, is herbals and supplements. And I've listed a few of the things that we have come across within our own clinic that are important, that we want to know that you've tried or currently are taking. CBD oil, we know that that's a pretty discussed topic these days, and a discussed substance. We want to know if you're on that. Ideally, if you could bring in the oil to clinic, that would be the most ideal, because a lot of people don't know how much is in their bottle. They just tell you how many drops they take. Another one that we have seen is tick tamer. This is kind of like a herbal blend that we have had patients try. Another one would be focus factor, magnesium, vitamin B6, and omega-3. If you're on something like tick tamer or focus factor, ideally if you could bring the bottle into us, that way we could see all of the ingredients on that, just to have an idea of what all you're actually taking. But we want to know if you feel like you've seen a response to that, and that you have tried these and how that is working for you. The next thing we are going to ask you about are interventions that you've tried. This could be a lot of different things, such as occupational therapy if you have sensory issues, cognitive behavioral therapy, CBIT. If you've tried CBIT, we want to know how that went for you. Play therapy, speech therapy, talk therapy, and social skills. Another thing on here that we didn't list that we definitely would also want to know is if you are going to places like Brain Balance or a chiropractor, just so that we know that you've tried that. And we would always recommend that if you are going to other interventions like that, you go to places that are evidence-based treatment, just because that's the best practice that's what we follow within our own division. But definitely want to know all of your responses to these therapies, and obviously if you thought that they were helpful. The next thing would be triggers. We want to know your home life. We want to know your interactions with your peers at school. All of the different things, how school is going for you. Do you get along with your teachers? All of these things we want to know. And this could include positive stressors, which would be things like holidays, vacations, birthdays, things that while they're good things in your life, they can also trigger tics just because it is an exciting time. Another thing would be negative stressors, things like you're being bullied at school, your parents are going through a divorce, any of those things. And one thing I would say is don't be ashamed to withhold anything from your care team. Don't feel like you have things that you're embarrassed to talk about, because we need to know all those things so that we can best treat you and help you manage those things. Another area would be environmental changes. If you've recently moved, if maybe there's a new sibling in the home, any sort of big environmental changes are other triggers that can definitely cause an increase in tics. And we just need to know so that we can say, okay, this is an area that could be why our tics are currently increased.
And one of the pieces about that too, Megan, is now, we're having to ask people, were these behaviors and tics present prior to COVID or after the coronavirus has kind of made its way across the country? Because this is such an odd and different time that we really need to get a good understanding. So all of the things that Megan shared, and then this ridiculous virus that we're experiencing has its own impact on how people are functioning.
Expected outcomes for the clinic visit. We always like to ask, I know Sandy likes to ask in intake kind of what their goals are for the appointment. Ultimately, she's usually speaking with the parent, so we usually get the parents' goals or the family's goals when they are have their intake done prior to the appointment. But when you come into clinic, we're going to want to know the patient's goals. I always like to tell the patients when they come to see us in clinic that they're kind of the drivers of this appointment. We're going to base treatment based on them and how they think their tics are bothersome to them. A lot of times they come in super anxious and they don't tic and they don't really have much to say. They don't always even know why they're here. And I just think it gives them a little bit of comfort to know that they have a say in their care. And ultimately they have a big say in their care. So we definitely want to know what would be a goal for the patient. What do they hope they get out of this visit? Do they hope that they get reduction in certain tics? Do they hope that they can get some reduction in maybe anxiety? But we definitely, number one, want to know patient goals. Second, we want to know the family's goals, because they're obviously a big part of the care team as well. So we want to know what goals the family has for the visit and how we can help facilitate those goals, whether it be, obviously a reduction in tics, but also how to help manage school issues, how to manage social issues, things like that. These are all things that we want to be sure we can address before the end of the visit. And at the end of the visit, a lot of times nursing likes to go in and say, were all of your goals met? Were all of your questions answered today? Because sometimes they don't think about it until the end of the visit, and then they're like, oh, wait, we didn't get to touch on this. But we definitely want to be sure to get all of your goals met for that visit. Now, understanding that those goals could change with each visit. Obviously, the initial visit, we're not always going to be able to address every possible outcome you could want, but just knowing what they are and knowing in subsequent visits that we have essentially a goal or a plan that we hope to get addressed with each visit. And then a discharge plan, a plan going forward of if you're going to try a medication, if you're going to try CBIT, if you're going to monitor and call us back if things worsen, what the plan is and when you need to call us back, if you need to call us back, if you're having side effects to the medication, if you don't seem to be responding, if tics have worsened and now you're ready to start a medication. All of that stuff we want to be sure we have laid out for you when you're discharged as well.
So I'm going to jump in here again. Poor Megan. She's just presenting and presenting, and then I keep going, oh, well, what about this? So I'm going to add this part, because she discussed the fact that it's really important to share the family's goals, and that it's really important for us to involve and engage the patient so that we can get the patient's goals. Because one of the things that sometimes happen, and Megan and I will attest to this, is that the family's goals and the patient's goals don't always match. And part of what you have to really work with your care team is how to bring those two goals together. We see a lot of parents that come in and they're so concerned and so fearful that the behaviors or the tics are going to create issues for their child, that they want their child treated with medication. And yet you talk to the child and the child says to you, I don't care, my tics don't bother me. So part of your care team is going to be addressing that with you and help you really kind of come to terms with that, and so everybody can be on the same page.
And then another thing is, once the appointment is over, interactions outside of the clinic visit with your care team and how those can be facilitated. Within our clinic, it would be phone calls or the patient portal. And in those phone calls or those portal messages, we want to know how your child's doing. If we started a new medication, we want to know how that's going. If there's a new issue at school, they're now being bullied, the school is not accommodating them with their tics, any of those things, we want you to reach out to us and let us know. We need to constantly be informed of these things so that we can help you as quickly as possible, take care of those challenges. So definitely stay in constant communication with your care team and have, any of these things, if any of these things we discussed have changed since we saw you last and you want to let us know, we definitely want you to call and reach out to us.
And remember, you don't have to be the person that makes the decision as to what caused the change in behavior. Sometimes it's important just to be able to talk through what has happened within your family or happened at school or happened at work, and let somebody else listen to that and help put some perspective with it and share it with the rest of the team so that we can get good guidance for you.
And so in summary, these are just some of the big topics that we like to discuss within our own clinic when we see patients. These are definitely the top topics that we want you guys to have prepared for us when you come to clinic. We know sometimes that's not always easy, and we're always going to ask questions to try to trigger those things and get as much out of you as we can. But if you want to really be prepared for your initial visit with your care team, definitely these are going to be some of the top topics that your care team is going to ask about, especially the medication history and the family history. Those are definitely very, very important. Do you have anything further, Sandy?
One of the things that I kind of want you guys to understand is that we have really shortened our presentation to kind of fit it into this framework today. And so we're ready for any questions if anybody has any questions that they might like to ask us.
Well, thank you, Sandy and Megan, for an excellent presentation. We have a few, but I just wanted to let everyone know that you can still submit questions through the questions pane in your control panel. If we're unable to get to everyone's questions, here at the TAA, we have a full-time information and referral staff who can answer your questions, as well as you can email support@tourette.org or call 1-888-4-TOURETTE. So let's get started with some of these questions. Well, the first one is actually a comment from someone who says, as a parent of now 2 kiddos of TS, you 2 ladies are an amazing resource for them, and this clinic is amazing. They've been going here for 7 years, and they want to thank you for everything you've done.
Thank you.
Yeah, thank you so much.
So some people are asking, how can you tell the difference between tics, autism stims, and OCD?
One of the pieces that you really look at between stimming and tics is how rhythmical it is. Tics are jerky. They're jerky movements. And if you think about stimming is a behavior that is calming and soothing. And so it's typically rhythmical. That can get really intense. You can see some spectrum disordered individuals rock really hard back and forth, but it is rhythmical. It's not jerky. Tics, as you all have seen, are real jerky movements. And the difference between OC and tics, oh my, sometimes we can't even tell the difference. And I say that because we work with some individuals that it's just real hard to know the difference. Sometimes the biggest difference and the easiest way to look at the differences is, do you have to do it just right? With obsessive compulsive disorder, you feel the need to do things a certain number of times in a certain manner. If you can't do it that way, then you go back and try to do it again until you can get it to be just right for you. And sometimes it kind of feels that way with tics, that you feel like you have to do that. But sometimes that's a premonitory urge that's pushing you rather than that need to be perfect. I hope that helps.
Okay, great. Another question we have is, how has CBIT been successfully adapted for children with both autism and TS, or occurring intellectual and cognitive disabilities?
Oh, I don't know that I'm real comfortable in answering that one. I'm not a CBIT therapist. I know that we do some really diligent exploration with the kids and with the families before we involve them in CBIT to make sure that CBIT doesn't become another stressor. Anything that you would want to add to that, Meghan?
I don't think so. I think that's pretty accurate. Neither one of us are CBIT therapists within our clinic, but yeah, I would say we definitely screen. Our CBIT therapists do a pretty good screening to see who's going to be the best fit for CBIT.
Okay. Someone said, my child is in 7th grade with active TS and increasing tics. He sees a counselor and is otherwise doing mostly well. Is it recommended to still see a neurologist or visit a specialized TS center for regular care?
I would say if you feel like your child is doing well with seeing the counselor, not necessarily do they need to see a neurologist or a center. I mean, if suddenly they're not doing well with counseling and the tics are out of control, and maybe then you want to look at trialing medication, definitely. Then I would definitely say seeing one of our centers. I don't know if Sandy has anything to add to that.
I think that's pretty accurate.
Okay. So when asking for family history, how far do you want to know about the extended family?
Typically, at least through grandparents. One of the things that we run into a problem with, and parents tell me this all the time, gosh, I don't know. Nobody was ever diagnosed. And that's pretty typical, because when you start to look very far back generationally, the diagnosis was not one that was done very often, or it was diagnosed as something else, or you see a lot of people that were maybe diagnosed with Asperger's back when Asperger's used to be a diagnosis, which is now just a spectrum disorder. And those Asperger's individuals may really have been a Tourette person, because there is such a similarity between the rigidity that you see with Asperger's and the rigidity that you can see with Tourette. So sometimes it's just kind of hard to tease some of that out.
But yeah, we usually, I mean, I know on the neurology side, when we ask family history, we definitely want to go back to like the child's first set of grandparents, siblings, and parents. But always, if you think that, an aunt or an uncle, if you want to give us that information, we will always welcome it.
Okay. So is there an appropriate way to go about changing providers or getting a second opinion? Are there like rules or etiquettes around this?
Usually it's a polite thing to do to ask your current care team for a referral. And it's always okay to share the reasons why, because most people just want the best for their child. And if that's the spirit that you ask in, most people will help you to find someone to see for a second opinion. It never hurts to have a second opinion. It kind of gets to be an issue if you start seeing lots and lots of providers, because that's when you start to see lots and lots of different interventions, and then it becomes unclear as to what direction you should move. But as far as asking for a second opinion, it doesn't hurt to do that.
And I would say if it was in a center like ours that's fairly large, if you're comfortable talking to the coordinator or one of the nurses there that you've worked closely with, talk to them. I mean, they can always help facilitate that for you as well.
Oh, absolutely. Absolutely. Because the other thing that happens is that you can get connected with one of the best providers on a care team. And if you don't connect with that person, or your child does not connect with that person, it just doesn't go well. So it's always okay to ask and to get some direction.
Okay, sounds good. So we're getting a lot of questions asking if you guys are able to assist families out of state via telehealth.
Oh my. we're gonna both just go, oh, take a deep breath.
Well, given the current COVID situation, we've gotten very comfortable in our telehealth knowledge. I mean, I suppose if you guys have questions and want to reach out to us, you can definitely always email us. We can always provide an email, and we could always try to communicate and help you guys the best that we can.
The problem that we run into with telehealth is that many states do not recognize our care team members. Right now, because of COVID-19, everybody has been in a state of emergency. So most states are allowing us to use telehealth. However, when the state of emergency is lifted, that may not be the case any longer. But it works for us. We can do it, and we've been doing it for several weeks now pretty effectively. I wish that insurance would just like jump on board and let us always manage to do this.
Okay, so another question we have is, how do you introduce Tourette to medical professionals who are not used to the condition? For example, when you're meeting a new primary care doctor.
I mean, obviously, ideally, everyone would have a medical professional would have some knowledge on Tourette. If not, I mean, I think if you have, like, I know within our own division, we give out a lot of information to our families, a lot of pamphlets, a lot of education in our D part. That is something that you could always present to them if they just don't have the knowledge on it. Refer them back to the Tourette Association's website if they have questions.
Oh, absolutely, because the Tourette Association has the most amazing, it's not a pamphlet, it's a folder that has all that information about Tourette, because a lot of people just believe that Tourette is equal to coprolalia and nothing else, and don't understand all the things that fall under the iceberg, the anxiety, the sensory, all of those things. And so, yeah, reach out to TAA and get some things from them.
Well, thank you for that. Okay, so someone said, my daughter has tics, OCD, and anxiety, and it's impacting her ability to go to school for over a year now. What recommendations would you have for parents to handle the anxieties and worries of our daughter falling behind and unable to recover?
Therapy. Therapy is going to be the biggest support piece, and to build a relationship with the school. Be honest with them, work with them, ask for their help. There are a lot of times that if you're really honest with your care team at school, that they are willing to really go above and beyond and help get kids into the classroom and work out strategies on how to maybe start with a class a day and work up to be able to be in school the whole entire day. Now, obviously, it doesn't work that way in all school districts, but it's always worth trying. But therapy is a huge component in success for many of our kids.
Okay, so someone else said, my 12-year-old sees a neurologist and he has not recommended any treatment or medication. Is that a typical recommendation? I know he's struggling with his TS, his tics, his OCD, and anxiety, but I don't have anyone to compare it to.
That's a hard question, because if you as a parent feel that your child is really struggling and your child's telling you that there are issues, it may be time to find a different team to work with. And that's really hard. And it's kind of like we talked in one of the previous questions about how do you go about getting a second opinion from someone. But if you feel like you're stuck, let that physician or nurse practitioner or whomever, let them know that you feel stuck. Have a session by yourself with that person and talk about your concerns, not with your child there, but just so that you can sit down and talk, because you may end up being on the same page and figure out some ways to intervene, or you may find that you need some help in a referral to another physician.
Okay, so someone else wanted to know a little bit more. What are the best tips for keeping the whole team connected and in sync so we address the whole TS plus iceberg for our 10-year-old?
Communication. I think that is obviously the biggest key, is communication amongst all the providers and care team members, along with the family. I would just say, if you're seeing a neurologist and a psychiatrist that maybe aren't in the same center, that you as the family do the best you can to keep everybody in the loop, and make sure that the providers are able to communicate with each other, because I think that's going to be the big key, that everyone has open communication.
Sign a release of information. Make sure everybody has the ability to talk to one another legally.
Okay, solid advice. Oh,
Pardon
continue.
me? She said solid advice. Oh, thank you.
We're good.
Okay. So this is a bit of a long one. How do you recommend we handle more complicated symptoms that we feel should be explored with a variety of methods when our doctor is only willing to prescribe meds to treat the symptoms a la carte? My 2 TS kids seem to struggle with falling asleep and sleeping through the night, as well as anxiety. Certainly they are linked, but our doctor is not interested in sleep studies, therapy, and wants to try meds as the first line of defense. And my kids are 15 and 12.
I would say again that that's a time to seek out a second opinion. If you don't feel like you're getting your needs met, definitely that would be time to start maybe seeking a second opinion for your children.
It may be good to ask why your physician is only interested in medication. I mean, that there may be a rationale behind that we don't know, because we're not part of that too.
Or if your provider maybe isn't comfortable managing those other things, I think it warrants a discussion. But then if you feel like your needs aren't getting met, or you guys aren't on the same page, that's definitely, again, a time to talk about a second opinion.
Okay, great. Well, thank you again for a wonderful presentation. This is all the time that we have for our conference session. Just to let everyone know, once the session is closed, you will receive a survey about the presentation. We would greatly appreciate it if you complete it and provide your feedback. We will also receive a follow-up. You will also receive a follow-up email within 24 to 48 hours with a link to view a recording of this session. Additionally, this session will be posted on the TAA's YouTube channel for those who are unable to participate today. We encourage you to reach out to us about this virtual conference or for other ideas and suggestions you may have. This presentation was presented free of charge thanks to our generous donors. If you appreciated the session, we welcome you to support the organization. Visit us at tourette.org to learn more and donate. Guys, is there anything else you wanted to add?
I don't think so. Thank you so much for letting us speak to you guys.
We really appreciate it. Thanks.
We appreciate having you guys speak. So on behalf of the Tourette Association, thank you again for joining us and taking the time to view our presentation. Have a great day, everyone.
Thank you.
Thanks.
Bye.
Oh, for God's sake.